Session with Dr. Farid Holakouee.
Good afternoon and welcome to In Session. I'm your host, Dr. Farid Holakouee, and I'll be with you for the next 2 hours here on Radio Hamra. Studio number to call in, 310-441-0555. I'm a licensed clinical psychologist, so you can call in with any questions related to clinical psychology, including any emotional or psychological issues, parenting issues, and relationship issues as well. You can also follow me on Twitter or Instagram or like my page on Facebook to get updates on the show or suggest topics or books for the program. And the shows are uploaded at the end of each week to my SoundCloud page and podcast on Spotify and Apple Podcasts. Again, our studio number 310-441-0555. A few announcements to start the show. First, the book of the week. It is called The Great Leveler by Walter Scheidel. The Great Leveler, Violence and the History of Inequality from the Stone Age to the 21st Century. So in a way, it's a historical account of the economics of inequality throughout the course of history. About 60 pages in. It's very fascinating, very dense, as often books like this about economics and history can be, but it's very interesting. As I mentioned on Monday's show, my father had seen this book discussed on Farid Zakaria on, I believe, CNN. And so I joked on Monday that I won't even be the first Farid to be talking about this book, but looking forward to it to finish reading and sharing with you on Monday's show. The Great Leveler, Violence and the History of Inequality from the Stone Age to the 21st Century by Walter Scheidel. And then also this coming Monday, I will be on a panel that is hosted by the Iranian student group at UCLA. It's called A Panel on Mental Health. That's this coming Monday, October 26th from 6 to 7 p.m. It will be on Zoom and it's open to the public, so anywhere in the world, 6 p.m. Los Angeles time this coming Monday, you can join. I will be on a panel with Dr. Nasreen Bashiri, who is a child, adolescent, and adult psychiatrist. So the two of us will be having a panel on mental health. A big thank you to the Iranian student group at UCLA for inviting me to participate. Hope to see you virtually this coming Monday, October 26th, 6 p.m. All right, so on Monday's show, I had shared some thoughts, actually did a whole segment on a documentary or docu-series I had seen this past weekend called The Vow, which looks at if you call it a cult, but that's obviously your judgment of it, and it really did turn into a cult, but a type of self-help group or self-transformation group called Nexium or ESP that was headed by Keith Raniere. And it was really fascinating. To me, I'm always interested to see these types of documentaries that explore a understanding of people and what they are going through or how they get to a certain point. And so seeing how people get enamored and sucked into this cult and how it affects them was quite interesting to me, and I really enjoyed it. I think it was very dark at times, very twisted to see how things went down, but also very interesting and fascinating. So it's called The Vow, and it was on HBO, 9 episodes. And so I wanted to talk a bit about cults or these types of groups, and they're not the same things, where people go in for self-help or transformation. There are many of them out there, and I am not in a way saying all of them are bad or have bad intentions, and definitely not all of them are cults, or as this one was sometimes called, a sex cult, because some of the practices that started happening within select members or smaller group of the members of the group. But wanted to share some of my thoughts on various aspects of it, from the individuals who get into it and also to the individuals that started and the heads of these types of groups, because there's certain patterns that we tend to see that can be important to keep in mind, because we get sucked into these things and it's almost like you get into an alternate reality, and over time you lose understanding of what even is going on. And because you have this new reality, everything seems different. And so when you look from the outside at someone who is in this type of a group, you might have a certain thought that how could that happen? But that's why I wanted to talk a bit about that side as well, not just the people at the top and what they're doing and their nefarious intentions and what's going on, but also people who join. Because this idea of an alternate reality that I just mentioned, we have to also keep in mind we talk about reality like it's this clear thing that can be identified, but we all have distortions in how we view things, and even coming up with one set reality is not so simple. And so we all see things in certain ways, and that can hopefully help just in an initial way of looking at someone who might join a certain type of group to think, as much as I might think I would never get sucked into something like this, there's already some beliefs we all hold on to, or ways of thinking, ways of looking at someone or something that probably are exaggerated, not exactly accurate, twisted, even could be seen as delusional. I sometimes argue that everyone virtually holds on to something that could be considered a delusion, meaning some type of thought or belief that doesn't match what we consider objective reality. So that's just something to keep in mind when we hear these stories of people who join these groups, that they're not somehow so different. There might be some tendencies that make people more likely to join a cult, let's say, or a group like this, or even want to go in for this type of a group. But it doesn't mean they're necessarily so different from everyone else. So these self-help groups very often, or these transformational groups, one thing I mentioned Monday, and I'll add again, there's often a lot of good in them. By that I mean everything they teach is not bad and wrong. There can be things, and I was watching a documentary and saying, okay, I actually think that's interesting insight. I agree with this part. Some parts I might say differently, but there was things that were good, and people do actually see some improvements in their life. It does help people in certain contexts and in certain ways. Not always in the way that it's presented, that if you do this course, your whole life will be different. And anyone who tells you something like that, or you hear something like that, you should always be wary. We, of course, like to think there could be this quick, miraculous fix to change everything and make our lives better. It would be nice if that were the case. But the truth is, there almost never is really something like that. And we should be skeptical with anyone who makes us think something is so easy, that changing ourselves is so easy, or that somehow becoming a new person or fixing our life in some way is going to be simple. When they sell us something that sounds too good to be true, we better be skeptical about it. I don't like to say something is impossible, but we want to be skeptical when someone says that, because we know there's so many people out there trying to trick us into thinking they can sell us something that will quickly fix whatever problems you have. So very often the way these groups are presented is that any problem you have, we're going to fix it. What's your issues? And everyone has issues. Every human being on this earth has issues. And so when they present it that way, and if they can get you into this magical thinking about the group, and usually the way people get into a group like this is others who've done the group will tell you about it. And again, you can get things out of the group, don't get me wrong, but it's very often presented as you're going to get rid of all your issues if you do this. And so we have to be always skeptical of that when someone tells us something like that. So they'll let you know whatever it is you're dealing with. We have sometimes they'll use words like technologies, and Nexium they did, and other ones. Technologies, which makes it sound very scientific, and sometimes there is some science behind what they're talking about. It makes it seem like there's something. Technology also makes it seem like it's something they have that others don't have. And so if you hear or see what they say, it's going to change your life, and others don't have access to it. We use these technologies and you're just going to be a different person. And this taps into a few things. One is the magical thinking that we can have, that there is this thing, this power. Sometimes they'll tell you about the person who's created it and how they are just wonderful. Wonderful is an understatement. They're usually godlike, use words like guru, but they sometimes feel that they are enlightened in some way, have some genius or spiritual abilities that no one else has. And so his or her, and usually it's his, teachings are going to just save your life because he is enlightened. In this case of Keith Raniere, he boasted of having a 240 IQ. I'm not sure exactly how that's possible, what that means. I did read somewhere that it was based on a take-home type of a test, or a test you do on your own. That's an honor system. But anyway, I'm not sure what that means of having an IQ of 240. And I think literally he would say, I'm the smartest man in the world. And so if you buy into that, if you buy what he's selling about himself, well, then it's that he has the answers. He knows things that others do not. He is the smartest person in the world. And interestingly, in a way, by putting that out there first, it can give you, if you believe it, this trust in him. But then you also can start to feel like, well, if I disagree with him, that makes me stupid. To disagree with the smartest man in the world means I'm dumb, or I'm missing something, or maybe it's too complex for me to understand. And that also helps in the process of making things that seem really strange or bizarre somehow feel like maybe they're right. Because if this guru, the one who's enlightened, is saying it, it must be so advanced that I can't even understand it, or it seems wrong, but it's actually right. And that's usually once you've really bought in very strongly, that you start doing these mental gymnastics to make anything you want to be true, or anything that is more comfortable for you to be true. But that's what we see. This sense that I'm going to say whatever, and you'll take it as truth, and we can find a way to say anything is true. Because if I do something that is hard for you, say, well, he's just challenging me to be better. If I say something that feels good, well, it just feels good. If I say something that's hard for you to understand or doesn't quite make sense, you think, I have to think longer to understand it. I have to process this, to ponder this. If I see something, say something completely contradictory, you can tell yourself, wow, it's so amazing that how I thought it was, it's exactly the opposite. So if you've given this person, and of course they self-proclaim it, and then the people who surround them talk about them in this way, there's usually a way of talking about the leader with so much respect and reverence, and that he's magical, he's touched their lives in ways that you wouldn't believe, he's transformed them, that when you're just around him, you feel something, that he's special, that he has some gift, that he's not like everyone else. And so we have this interplay where the person wants to come off that way and draws people to them who want to find someone who is that way. We are looking for some savior to fix all of our problems. I'm so broken, we all think, and someone is going to fix that. And that's what we're looking for. And so we have to be very aware, something I've repeated a bunch of times recently. No one can do the thinking for you. You can never stop thinking for yourself. Even as I do this show and people listen, and I hope they get something out of it, but I hope they always listen with a critical ear and mind, that they hear what I'm saying and they reflect on it and see what makes sense, what doesn't make sense for themselves. And that you have to first of all see what makes sense for you, and also I just could be wrong in general, not just about your own personal experience. But in these cases, when you enter these types of environments, you are expected, and the culture, and we talk about cult, but there's a culture that we don't challenge what the guru is saying. And after the break, I'll also talk a bit about some of the ways they challenge you if you challenge something, or the way you can get attacked when you say something that is against the group, or especially against the leader in some ways, and the gaslighting and the ways they manipulate things to get you to feel like you are wrong or bad if you are missing something or not seeing something. So I'll continue talking about things related to cults, but especially about these self-help type of groups with gurus that turn into cult-like behaviors or experiences. And specifically, I was talking about The Vow, which is a docuseries on HBO. Let's go to our first commercial break. We'll be right back. Welcome back. In the first segment, I was talking about the docuseries The Vow, or some thoughts on that, where we see a self-help group that turns into a cult, and When you see something like this, you can imagine how, or try to imagine why would people get sucked into this. But as I mentioned, it's a little bit easier said than done to think that I would never let that happen to me. And with these types of things, first you get a little bit sucked in, but slowly you get immersed in the culture that is there, and it affects you in ways. And when we're in a group setting and around people, and especially over time, it could really distort the way you see things. And even I did one of these types of groups, I think it was about 11 years ago. Yeah, probably 10, 11 years ago. And I did a few of the different types of classes. And first of all, I did gain some things out of it. So, like I said in the first segment, it's not all bad things. There can be good things in them for sure. And for some people, it can be very meaningful. And I don't want to take that away from them. I think when, like anything, when it gets too extreme or you get too involved with it, it can be concerning and starts to have some negative effects in the ways that you are seeing yourself and the world, and actually how connected you are to the world. But you can have some good experiences from it. But I went through something like this, and it was 3 different courses, and one of them was more lengthy type of an experience. And when I look back, there were times that I got sucked into certain degrees to seeing things in a certain way, or the ideas of the group affecting me in ways that when I look back, I think, wow, why did I get that into certain parts of it? I was very skeptical even throughout, but still I can see how I got affected by being part of the group, wanting to be accepted by the group, and getting in some ways even manipulated by things that were going on that now I would think and hope I wouldn't get manipulated by, but then I did have some impact of that. So I say that to recognize that it's very easy to judge someone in some situation. Not the same, but similar to like an abusive relationship where people think, how could you let that happen? Or he or she must actually like it if they're still in the relationship, or various things that we say to ourselves to justify that we would never let that happen to us. But we don't recognize the dynamics that are in play, that when you start to create a relationship and then with that relationship create a certain type of reality, it's very different than when you look from the outside. So people, they get into the group with hopes of fixing themselves. And this is in some ways an easy sell, because as I mentioned previously, we all have issues. Everyone has issues. So if someone says, hey, we have the solution, most people can be drawn to that. It's very exciting and appealing to think someone has those answers. And it is done in a way that feels kind of magical, but that taps into our sense of magical thinking, which we all have, but especially if we've seen some trauma or disruptions in our development in early childhood, especially 5, 6 years of age, you might say, but other ages as well, you might see that we're more drawn towards this wanting of magical thinking. That there is something that's just gonna, like a fairy tale, and the fairy, someone comes and casts a spell on us, or gives us a wish, and we all of a sudden become a different person. And so they sell this idea very often of the human being at its full potential, which I'm all about too. I think something I try to discuss on my show and something in my work with clients is to help bring out more of their potential. But often it's sold in this absolute type of way, that we're going to get rid of all your fears, all the things that hold you back. Everything's just going to go away, and then you're going to be 100% you at your fullest potential. Which reminds you of when people say things like, oh, we only use 10% of our brain at any time. Imagine if you used all 100%. And there's no basis for this 10% of your brain thing. I've heard it since I was younger. I don't remember how long ago, but it's been many years that I've heard it, and it's almost taken as some kind of fact. But when you look at neuroscience, they don't talk about using 10% of your brain, and it matters what you're doing. It's also like if you were walking, you used your arms to a certain degree, but if you were using your arms 100%, it might be actually bad. So it's not this very clear thing to say you should be using all the parts of your brain all of the time. They function in different ways, or your brain functions a certain way, but there's no evidence to this. But we have this tendency to believe almost like we have some untapped superpowers, and they tap into that in these types of groups to make you feel like, you know what, you can, it also reminds me actually of speed reading. We all can read 100 pages in a few minutes if we just knew the techniques, and we're going to teach you the techniques, and we feel like we have this, or that our memory can somehow remember everything. Everything is tape recorded, and we're going to get everything out, and you can repeat everything that ever happened in your life, which is also not true. So there's ways that they try to tap into your own narcissism in a way, a narcissism that's a defense towards your own feelings of not being strong or not having enough or being enough, that we compensate with. But I have these insecurities, these weaknesses, but actually maybe I'm like a superhero. Maybe I am so amazing that they're going to help me bring out that. And we all do have more to contribute. And I think no human being has really met their full potential in their life if you look at doing everything they could to grow and express themselves in some idealized way. But it doesn't mean there's a simple solution that's going to make that happen and make that change. But they sell you that, and you think, well, why not? You spend a few days, sometimes a few $1,000s, or maybe a few hundred, depending on the type of course, and they're going to help you bring this out. And the events themselves can really bring you a feeling of like a euphoria, because you're in this group and everyone is sharing love and talking about their goals and dreams and making them feel so real. You almost feel like you've already accomplished your dreams. And they really do a good job of that, and that can suck you in even more. Before that, at times, there are parts where they break you down. Almost in insulting ways. Some of my experience was even like that. Disrespectful, I would say. Putting you down. And again, we all can succumb to this. You don't have to, and some won't no matter what. But especially in these kinds of environments where it becomes part of what's expected, where they put you down. And of course, we all have insecurities. So if someone says, you're this, you're lazy, you don't do enough, you don't this, you come up and you show up to me like you're a da-da-da-da-da, whatever it might be, it can tap into insecurities that you have. And also, if you're told that the person telling you is knowledgeable and insightful, you feel like, wow, they really see me. And it can tap into those insecurities you have. So if someone tells you you're lazy and you feel like I do waste time, everyone does, but you might have some insecurity about it, or you think, wow, I really could be more productive, you'll think they're right, and they have the right to tell me, and this is some tough love to make me grow, when really they're just putting you down and tapping into some insecurity that almost everyone can have, or that we all can feel, but they make it feel very real and very big, and you feel like almost I don't have the right to fight back, or this is good, this is helping me, and it makes it very easy for them to further that by coming at you in that way. So unfortunately, they very often will in some ways break you down by saying very human things. Sometimes I would joke, when people would ask me that, you're studying psychology, can you read my mind? You could just say a very generic thing like, I can kind of see that you're confident, like you believe in yourself, but deep down there's these insecurities that hold you back from doing what you really know you can do or want to do. And you just know that if you can get past those things, there's so much you can share with the world. And I would say that to someone, and sometimes they'll be like, wow, how did you know that? And it's like, that's true of everyone. Basically, everyone has these types of feelings, or almost everyone. But most people have this sense that, yeah, there's some things that hold me back from being even greater. Like, yeah, that's being human. We all have that. We all make mistakes, or don't try things, or have fears of failure, fear of this and that get in the way. That's pretty human, but they can make you feel like they're seeing you. And that can be very impactful in making you buy into the whole thing. Now, looking at the leaders of these groups, it's interesting because, of course, there's a huge narcissism there, that I want to be a god and be godlike. And they'll tell you that they are somehow smarter than you know. They might, in some implicit way, acknowledge they're not perfect. This is an interesting thing you'll often see, where they say, of course I'm not perfect, I make so many mistakes, but very rarely will they tell you about a specific one or acknowledge that they have some weakness now. So it's in this way of showing humility, in some way of also showing how a false humility, and showing somehow that they are human like you in a way so you can connect, but they rarely will tell you, I still struggle with something. And this in some ways can contribute to this godlike feeling that they don't have any issues, they've solved everything, because of course they're selling you some quote unquote technology or techniques that is going to fix all your problems. So of course they've done it with themselves and proved it, and that's why they are this amazing thing. And so they take on this godlike quality. Clearly, there's an insecurity underneath that makes them want to be larger than life in this way. In this case of Keith Raniere, you can see such a strong anger towards women. Later in the later episodes of the show, they show some of the behind the scenes talking down to women, these classes he created where women were being basically disrespected because they were needed to learn that really young boys have it the hardest. So they have to understand that pain, to understand men, to then really create some kind of balance between men and women or to advance society. But it's just really men disrespecting the women. And clearly it seems to be a reflection of his own experience of probably feeling very weak or small as a boy and potentially having some issues with either his mom or with other women, where he's just taking out this anger on them. And the way he's treating them and talking about them, it's very clear there is this anger there. And it's a reminder that everyone is human. Even if, like, let's say he's a great teacher, he had some good concepts, but he's a monster when you look at what he was doing. But it doesn't mean they don't have their own issues or insecurities that are always going to color the way they see things. Me included, everyone you hear speaking, you might think they're being objective, and they're trying to be. It doesn't mean everything is pure bias. But we all have experiences that color the way that we see things. And I remember taking a class in a graduate school that was very eye-opening for me, where I was looking at different theorists in psychology and recognizing that the theories they came up with to explain human beings, human behavior, therapy, they were affected by both the historical context and culture that they grew up in, and also their own unique experiences and what they went through in their family dynamics. So if someone had a bad relationship with their mother, again, I don't know exactly what this gentleman's relationship was, we can understand that would lead to this way of wanting to disparage them or put them down or overpower them later in his life. It would make sense that he would be wanting to do that, but it could just seem like, oh, it's just objective because he's so brilliant. So this is the reality of the world, and not realizing himself, possibly not realizing, but others not realizing this could be a reflection of something in him that's bad rather than something in him that's good. And so again, no one knows everything. Everyone is wrong about things. I'm actually looking, I mentioned again, and I'll say it again, Einstein was wrong about things related to science, even though he might have been the greatest scientist of the 20th generation. Whoever you think is a great scholar in whatever area or field will make things or statements in that field that are not true, and also, of course, about things that are not related to what they studied. And we have to be open and ready to accept that as much as we like to idealize someone who's very wise and knowledgeable and smart is still wrong sometimes. And that doesn't mean they're not knowledgeable. It means they're human. And all human beings are fallible, have their biases, and have their miscalculations or misjudgments about things. Doesn't mean they can't still be great, but it means they are still human. And we have to never lose sight of that. So if you're in some group and you get the sense that the leader can't be challenged, that's a big problem. And we do see that, thankfully, leadership is moving in the direction where people recognize this, and a strong leader isn't one that never says they are wrong or won't allow you to challenge them, but a genuine strong leader will allow you to challenge them, will acknowledge their real mistakes and share them with you, will acknowledge they're still trying to grow or understand certain things and they don't know everything. I posted this quote recently from what I talked about on the show, that a wise man once said, "I don't know." A wise person, man, woman, that because that's someone who's wise understands they don't know everything. And one way this plays out in these types of groups, and I even had this experience, is that if you ever challenge the group or challenge the leader, so let's say you disagree, say, "I don't think that's right what you're saying," or "what you're doing is wrong," to people, they turn it back on you. So they'll say something like, "Oh, you think what the leader is doing is unfair to people or in the group? Well, where else does that show up in your life that you're not trusting of people?" And so it's this very manipulative type of gaslighting, where it's that instead of talking about what you're seeing and how there could be some validity to it, it's assumed that the leader can't be wrong. So if you are having some issue with it, this must be your issue. And so, of course, if someone says, do you ever not trust people? I think sometimes you don't trust, you said your mom or your dad, you didn't trust them a little bit, right? Now they make it about you. And again, they take advantage of the fact that you're not perfect, which no one is. And so you start to think, oh, wow, yeah, maybe this is my thing. Maybe this is me again, having a judgment that's getting in the way of my life. Where else does this show up in your life? How else does this get in the way of your life? Not trusting others. And we've all had issues with trust. Some might have obviously more significant ones, but we all do. And so it's this very impactful and unfortunately oftentimes successful way of getting people to realize or think they're realizing that what they're feeling isn't about what the leader is doing or what the material is about, but about their own weakness. Oh, this is good. This is showing us your issue related to trust or your issue related to letting go or your issue of whatever it might be. And so they put it back on you and you can feel very stuck. Like, oh yeah. And here's where the manipulation goes another step. Usually you've been involved with the group in some ways and you've opened up about so many things. They know your sensitive point. So they know they can say, oh, is this maybe about your mom and how she left when you were 5? Oh yeah. We know that trusting is so scary for you. Imagine if you were in a world where you could trust and believe that the people around you were actually trying to help you, because we're trying to help you. Haven't we helped you? And they can just go on with this type of kind of quote unquote logic to get you to feel like I'm the problem here, I'm the issue. And, kind of like a immune system, when I was in the group and you see it, anytime someone challenges, everyone just attacks that person so fast, like they have to just get rid of that so quickly, which is probably for multiple reasons, including the fact that probably everyone inside of themselves is having a hard time believing everything that they're being told or everything that's happening. So they have their own doubts inside that are being triggered, and so they can't handle that because of the cognitive dissonance of, no, this is the leader, this group's the best thing that's ever happened to me, nothing can change that. And unfortunately, they'll try to snuff you out as quickly as they can. You can't disagree. And if you do, what are you doing? What's wrong with you? I remember having some experiences where I would share things that weren't making sense when I was in the group, and just everyone would attack me to the point where one time I was literally arguing that isn't sleep important, because people were not getting enough sleep in the group and they're saying that's okay and it doesn't matter, and for months even if they don't get enough sleep. And so I challenged this and I was just quickly attacked by everyone from different types of leaders, and there's usually different tiers, to the individuals in the group, that why was I saying this, or how could I say this, and what was wrong with me that I was saying something like that sleep is an important part of taking care of ourselves. So it's an interesting dynamic and culture that can develop. And yes, it can be cult-ish. And you can have this sense when you can't challenge the leader, when everyone has to think the same way, when the leader's personality and who they are and also their teachings are untouchable and unquestionable. These should all be things that make you feel a little bit skeptical. So again, it's not to say self-help transformation is not good. It can be very helpful and good, and you can get a lot out of different types of classes. Heck, I've done seminars myself where I hope people come and get something out of it. But you want to be very aware of when you get sucked into some of these things, that at times they can have some nefarious, and in this case of Nexium, we saw some horrible things. I didn't even get to all of that, and maybe that's okay. It would have been a spoiler if I told you some of the things that happened there, and I recommend you check out the docu-series yourself called The Vow. But sometimes some very horrible things are happening. Doesn't mean everyone has those intentions, but just some things of words of warning to be mindful of, that when you're joining some kind of group, or when you find yourself so much wanting to find that quick fix that's going to take your problems away, be aware that usually it's not going to be that simple. And that means that either they're selling you something or they're selling you themselves to turn into your guru or your god. Let's go to another commercial break. Studio number 310-441-0555. We'll be right back. Welcome back. Studio number 310-441-0555. Let's bring on a caller. Radio Hamra, you're on the air.
Hi there.
Hi, thanks for calling.
Oh, thank you for your time, Dr. Farid.
My pleasure. How can I help you? Let me know what the question is.
Actually, I have two questions.
Uh-huh.
One about myself and the other about my daughter. I I asked about mine first.
Okay.
I am 52 years. I'm 52 years, and I came to the United States about 5 years ago. In that time, I was very stressful, and I had a lot of anxiety, and I didn't have any access to the clinical help. So I was very lucky that became familiar with your dad when you on the radio. So I tried
Mm-hmm.
to listen to you both, and I understood that I need clinical help. So I didn't have good insurance. I had chance to go to the doctor about 2 years ago. It was a good insurance, and they gave me some medication for my stress and depression. It was
Okay.
very helpful, and I told that because of your I was listening to you and your dad. I helped myself a lot,
Oh, good.
so I could be very better, and came out of my deep depression. Um, but when I talked to it was just my family doctor that gave me medication. I diagnosed with cancer about 1 year ago, and they want to start my medication for cancer. And my oncologist told me that your medication, you should change your medication, and I think your anxiety is not as good as enough that your family doctor can prescribe you. So they refer me to a psychiatrist.
Mm-hmm.
And when I was talking to my psychiatrist, because I was listening to you, I asked her if she could get an MPI test, but she asked me some questions, and because of the answer, she told me you don't need to have that test.
Mm-hmm.
And I should say, because of my family story, my dad, as I remember, had a deep depression, had some shock therapy,
Uh-huh.
and I knew before that he was a person who was very, he had sometimes had very high energy, and I don't know what's the diagnosis with him because he died when I was 15. And I knew that, I heard that, because we didn't have any relation with my dad's family. I don't know them. But I've heard that my uncles and one of my cousins have some problem too. I know my cousin diagnosed with bipolar. So when my psychiatrist didn't accept to have the test from me, I'm not sure that which problem I have, if I am bipolar or not.
Well, let me give you some. Let me just because you shared a lot of things that I want to make sure I address some of them. The first thing, as they recommended to you, I would always, and I don't know if we're on speakerphone. I'm getting some feedback from you. Are we
I'm
on
not
speaker?
sure. No, I'm not on the speaker.
Okay.
I'm speaking
Okay.
directly
Maybe.
to the phone. Sorry
Okay.
about that.
No, that's not. I don't think it's anything you're doing. So the first thing is when it comes to getting medication for a psychological psychiatric issue, I would always recommend seeing a psychiatrist. I think 60-70%, I've seen different statistics of psychiatric medications are prescribed by general practitioners or the family doctor. But this is not the ideal or what we would want to do, because the psychiatrist, of course, specializes in these issues and can be much better at doing that than getting it from your general doctor. Now, as far as your treatment, and I don't know how the cancer treatment is going. I wish you all the best in that.
Thank you.
But we do have to be aware of the interactions of medications, and there are even some psychiatrists, I don't know if the one they recommended to you, who specialize in working with people dealing with cancer treatment, so like an oncological psychiatrist, and that would be obviously recommended, so they really know the different types of interaction effects of medications with the types of treatment and medications you'll need for your cancer. Now, as far as the MMPI goes, testing like that, it's not something usually a psychiatrist is going to do if they're just going to try to get a diagnosis and prescribe you medication. It's not very common. They don't usually do that type of testing unless someone, for some forensic reason or some specific reason needs to get a lot of testing done. But usually it's not something, so I would not at all be concerned about that the psychiatrist did not want to do the MMPI. They usually don't. These things you're saying are the things that he or she will want to know. Your family history, it can be very important, but then also what symptoms you have yourself to share with the psychiatrist and what you're going through. So I don't think there's a need for the MMPI for you. And so don't be at all discouraged by the psychiatrist not wanting to do that. And especially, the psychiatrist, you can make that request. Of course, you're the patient, but often a doctor doesn't want you to tell them what to do. You can make a suggestion and hopefully they'll be open to it. But, they probably do things a certain way that works for them. And I would trust that. And in this case, like I said, not taking the MMPI is not something I'd be concerned about. That's a personality test or inventory, but it does talk about some psychopathology or tell us some things, but usually used as a diagnostic tool. It's not usually the case. So it's not that they need to give you that to give you a diagnosis and then prescribe you the right medications. But I think it's good that you're seeing a psychiatrist and go forward with what they say.
Okay, thank you so much.
Sure.
Hopefully I survive from my cancer after surgery, yes, it's very nice.
Yeah, I hope you do.
Okay.
I hope you do. And of course, as I'm sure you know, it could obviously physically it has such an impact, but emotionally, mentally itself, it can have big impacts too. Many people dealing with cancer can get depression or more anxiety that you're experiencing. So I hope you'll do everything for all aspects of your treatment, and of course, wish you the best with that.
Actually, it was very nice that I got cancer after I had my medication for my anxiety and depression for about 6 or 7 months. So, and I was continuing to listen to you and your dad. So I was I was in a very, very good situation that I was very open to accept any truth. So when they told me that you have got cancer and should go through the treatment and surgery, and it was nothing for me. I was very relaxed and accept that. I went to a trip before my surgery, and after that, every time when I had any appointment, just like to be in a doctor, I tried to have a very good thing. I was very relaxed, and I'm not sure what my brother-in-law told me. Oh, I think you are bipolar, because every person when they are in this situation, they're very stressful, but you are very relaxed, and I was. So I'm not sure if it was true or not. I'm not sure.
Well, let me say some. What you shared seems like you have a very strong or resilient attitude about what you're going through. Like, even though you said, "Oh, it was good timing," or most people would not say that. It's never a good time, I think, for anyone to get that illness. But it's good that you're able to at least try to see the good in it, if that feels good to you. Bipolar is not something where you're just in a good mood about something or for a period of for a long period of time. When you have that good mood, like the mania, the high of the bipolar, you are, you need less sleep. You have a very elevated mood and feel good all the time about yourself. You might even make risky decisions, bad decisions in your life because of that feeling. It's not just being optimistic, as it seems like you were describing, but what would make you think you have bipolar other than what your father-in-law said?
My brother-in-law he told me, because he was with me. My husband is a disabled person, so he was with me in when I had an appointment. So he told me, "Oh, you are very relaxed. You are laughing. It's just it seems that you are have a very ordinary treatment. You are going to the surgery. They are going to ambulate your body, but you don't care about that." And I said, "Yes, because I heard from Dr. Farid and his dad that they told me we are doing our best. There is no matter what the result. I don't think about the result. I just put on the doctors and I'm going through the treatment. I'm not anxious." And when he told me that sentence, I said, "Oh, maybe I am. I'm not sure." Because
well, I don't know what you're describing. First of all, you're saying you learned. Maybe you could say from my father, and but you're saying also me. I don't want to claim that I've taught you something that is more advanced, and I don't know if I could do that. What you're saying is very not easy to do. To have that kind of attitude when you're going into surgery or some kind of treatment. So I appreciate that you're saying it was from us, but I hope you give yourself a lot of credit for being able to maintain that type of mindset or spirit when you're going through something difficult. So he was surprised, it seems, that he expected you to be in a very negative state of mind, very anxious, very sad, but you weren't. It's not clear to me from just what you shared if what you were experiencing is some kind of illness. It's kind of funny that sometimes something that might be good, because we're not used to seeing it, we might think it's something's wrong with you. Why are you in such a good mood? Which is funny, because usually when someone's in a bad mood, we think they're not doing well. But I don't know if it was just you were trusting of the professionals who are going to take care of you, which I think makes sense. There's nothing you can do. You can't control your surgery or your treatment in those ways. So it's better to trust and just let them do what they've been trained and educated to do, and let them handle it. Easier said than done very often, but if you can do that, great. So to me, it doesn't sound like something alarming. I've sometimes seen people, it doesn't seem like this is what you're describing, where because they're so worried about people around them or always being positive around people, they might be really sad or scared inside, but they'll show they're really happy for the people around them. But that doesn't seem like what you were describing there. So you're saying you really did feel okay going into the treatment?
yes.
Okay. Yeah. If you felt, that itself does not, alarm me. Maybe I think you said brother-in-law was surprised, but I don't think it's something really bad.
Because when I was talking to my doctor about the ambulating, I had a breast cancer. So when I was talking to my surgeon and lab, and we talk about that if I want to do implant and I don't want, because of this reaction, and even when I want to go to the surgery room, I was laughing and hit them, and I said, "Bye-bye, I will see you." And then I opened my mind. I didn't care about my body, and I was laughing. I said, "Oh, I have some AIDS," but and I just thought I thought it's very normal. I don't know.
Yeah. Well, again, I think it's hard to say exactly what, from my perspective, what you were going through, but it seems like you had accepted it, which it can be hard for people to do, and people do it at different times. Some people might not be able to, and we're just looking at it. Well, this is parts of my body, and it is part of you, but in a way not part of you too. How did the doctors seem to respond to how you were? Did they seem okay with it, or were they surprised?
Yes. No, it was very okay, and no, they weren't surprised and asked about something. He was actually a surgeon, plastic surgery that we talked about that, and he laughed, and he was agree with my decision because I didn't decide to have an implant, because I told I'm going through a big process. I don't want to challenge with other one, because I heard that maybe we have infection if we want to do that. So, and he was said, "Yes, you are right," and because I have a sense of humor, I said something and we laughed. No, it was very normal.
Of course, the doctor has met with many patients, and I'm sure he's seen different reactions, but it seems like he was joking with you and enjoying it, and you were trying to make light of a dark situation, possibly. But to me, it doesn't seem like definitely not something wrong. And I think you, you know, responded in a way that was good for you, and that's good. And for your brother-in-law was surprising, but that doesn't mean him being surprised means it was something unhealthy. That doesn't sound like bipolar to me at all. Like I said, sometimes someone might hide some of their feelings for different reasons, or we compensate, and if we're actually scared we might act like we're not scared or something, but it doesn't seem like it was that either. To me it sounds okay, and I actually really can commend your attitude that you were trying to accept that this is the reality, this is what's going to happen to my body, I'm going to have to accept it, and that's okay. And I don't know if you mentioned your husband having a disability. There could be a way that you look at your body slightly differently, or experiencing him having a disability might have had some kind of a positive impact in how you can be okay with something happening to your body. Do you think that's possible?
Mm, I'm not sure about
Okay.
that because my husband's disability actually it's not a big deal for me. I've never think about that.
Okay.
Um,
What,
yes.
if I may ask, what is his disability?
Oh, he went to coma about 30 years ago, and he got CPM disease during the coma. It's a very rare disease, and it caused his upper kidney hormones level, and thyroid, all together caused that after coma he couldn't move, and the doctor told that he would have a planet living, but because he was a very strong man, and he had and he tried a lot, exercised a lot, and a lot of treatment. He could walk, but because of his muscles are very tight because of this disease.
I see. Okay.
He should use walker. He cannot talk good. It's not obvious, so it's a kind of disability.
I see. Okay. But I mean, I think it's, I was wondering if that had some impact in some even positive way of how you viewed your own body and being okay. Of course, it's challenging and it's very personal. But from what you're describing, it seems like you were just accepting of your reality, which is one of the most important things we can do, but oftentimes very hard for us to accept, and we don't want to accept it. So I didn't hear anything concerning in what you said. We're past the commercial break, and we could talk more about this. I know you said you also have a question about your daughter.
Thank you
So
much.
we're going to put you on hold, and I'll bring you back after the break, okay?
I have one. I didn't ask my main question about myself. Thank you so much. I will wait.
Okay, sure. Okay, we'll be right back.
Thank you.
Welcome back. Let's go back to our caller. Caller, are you still there?
Hi there.
Hi. So you said you wanted to share, we did talk about your health and then also getting some meeting with a psychiatrist, but you said you had a question that we didn't get to yet.
Yes, and now I am in relation with my psychiatrist and oncologist about the medication, and my psychiatrist, refer me to psychology, and just we start to talk. I think we had just one session, and I don't know what should I ask from my psychologist, because when we was talking, and my main problem is my daughter, and I was talking to her about that. After that, she asked me that, what do you want to do in this psychology? And I really don't know what should I ask, because now I think further to my daughter, I have some problem too. Although I try to increase my knowledge, and have medication. Recently, again, I thought I have more anxiety, and I'm not sure if I ask her to, because I have a very bad childhood, I have a very bad family history, so I'm not sure how can I manage the session, because I thought some psychologists are not as professional to manage the session, so maybe I can help to the session and go through the right way and get the best help from her.
Well, I think it's good. Obviously, I want you to get the best help from her, but you're gonna it's going to be important to let her give you the best help and to trust her, just like you trusted your medical doctors. It can be important to trust her. And I want to be careful, since you're seeing her, not to, analyze too much or tell you what you might be feeling or things that are going on, because of you're working with her. But it seems like it's hard for you to even let her or trust that she can take care of you or handle what you've been through. And so what I would recommend is to go in there, as is the case with everyone, being as open and honest and being as open as you feel comfortable being, but trusting the therapist to take care of you. You don't need to take care of the session or make sure you do enough. It seems like this is your tendency of taking care of others, that even in your therapy you want to take care of her.
Dr. Farid, because before this lady, I had another psychologist from this insurance. She was not a psychologist, she was a counselor. When I went to her, she asked me, so I'm here just to listen to you, and said, oh, so what do you do next? And she told me, I'm just listening here, and I'm here just to listen to you. And she didn't give me she didn't ask me anything that, that can manage the session and go through the problem. So after that, I start to listen to you and your dad, and I found, this. So I left. I didn't go back to that lady. So I, when I listened, I found, some of my problems is this, is that. I didn't have chance to talk to your dad because it's very busy, that phone every time. So, but I try to listen every day and your sessions too. So I found some of my problems. Now, this lady is a psychologist, and I thought this was the first session. But I thought maybe it's just like the other lady, because she didn't ask me many main questions that you and your dad used to ask about the people. And, even the people don't know what's the problem.
Sure. But so let me...
You will find that.
No, but so let me, the thing also to keep in mind is, I see clients in therapy, and the way therapy is different from when you call into something like this kind of a show or my father's show. So if you expect that from the therapist, you're almost never going to get that. And really you shouldn't. It's a different thing than when you call in. So I don't want you to think that because this psychologist is not being so direct or asking you so many questions, that means she's not good or can't help you. It's just something to remember, that therapy is different. This is not therapy what even me and you are doing. Does it have some elements that can be similar? Yes, but it's not the same thing. So you shouldn't expect the session to look like this kind of a call or a call that you hear with my father, because it's a different type of a thing. So I wouldn't be so concerned. A lot of the therapist does listen, but of course we'll ask questions, we'll have suggestions, but a lot more of it is listening. And I would trust, and trust is something you build slowly, but I hope you can give her some level of trust to share with her more and more, and see what you're going to get from her. And one session is not even really, it's not even starting, it's like doing pre-operation stuff. It's not even getting into it. So it takes some time. So again, if you listen to, let's say, my father, and after 15 minutes, they talk about something and he gives some solutions or some suggestions, that's not what you should expect from a therapy session. It's more about a longer process that you build a relationship and you'll get something. And so I would see if you can let yourself trust her more. You could even share your experience, maybe you already did, with the other therapist, and what you didn't like, what you're expecting. But you shouldn't feel like you need to prepare. It's really your space to talk about whatever you want and what's on your mind. I'm wondering if you have this tendency to want to take care of others, so even in there you feel like you have to be the one that takes care of everyone or takes care of things. But in your, with the medical doctors, you said you were very trusting, and I think that's good. Let them do what they're trained to do, and try to do the same thing with her. She's trained to help you, and have some trust and faith in that, and at least try for a while. If after months you see you don't feel anything, or nothing feels different, then that's something. But I wouldn't make a decision after one time unless you really didn't like her, which it doesn't seem like that's the case. I would give it more of a chance, and don't expect that it's going to be something like even our phone conversation or what you might see or hear on my father's show.
Yes, maybe because of my English, I didn't tell my, demand directly.
Yeah.
This psychologist asked me, tell me about your childhood a little, and then
Yeah.
I told her. So after that and my problems with my daughter and everything, she told me, what do you want to do? What do you want from this session? What do you
Yeah.
want? Is it, because I trust you and your dad, I think everything is good. And because I
No,
have a
no.
lot of progress, you helped me. If I was not familiar with your dad, I didn't go through that big process of cancer with this optimistic. I'm sure.
Well, I'm
Because,
happy to hear that, but I would trust her too. But when she's asking you a question, and I would ask you the same thing, what do you hope to get from the therapy sessions?
okay, the first thing that I, although I increased my knowledge and I have medication, I was very good. But recently I feel some anxiety, but I don't know, I cannot find that. I help myself a lot, but now at this moment, I don't know where is it from, because
Okay.
when I'm in a very stressful, I try to use the quotation and everything that I heard from you, but
Yeah.
now I think it does. I'm not sure if I should change my medication. I'm not sure what's the
Well,
problem.
yeah.
It seems that I have my anxiety is just not like the 1.5 years ago.
Okay.
So
Well,
it's
that I
very
mean,
good if she can help me.
yeah, that would be great. And I think that's what I mean. You can share that with her. That my anxiety has been higher. You're trying these things, and that's great. But that's why we also can get help from others. That's why she's there to help you with the anxiety. So I would just trust to just share with her, be as open as you can be about what you're going through, and say, this is what I'm dealing with. And again, there's this sense of what you're saying, I should be able to deal with it on my own, or why is what I'm doing not working? Which I understand, if it worked and now it's not working, you might have some feelings about that. But you don't need to do it all by yourself. That's why she's going to be there to help you with that. And so I would just trust her that you can share with her what you're going through. Therapy is, again, a process that takes some time, but it can be very helpful and make longer lasting changes that can be meaningful. So I hope you will give her some trust and see how much she can help you with what you're dealing with.
Okay, sure. Thank you so much. I appreciate it.
Sure. Thank you. And I know we're at a commercial break. I don't know if you asked about your daughter, which you wanted to ask, or if it was.
If you have time, I can. I know it's the answer is just like a miracle, but my daughter diagnosed with borderline and bipolar.
Okay.
So we had a
So
very
let's.
challenging time.
That is, I'm sure that is challenging. And so because of that, I don't want to just give a quick, make you say it quickly and have a quick answer. Let's talk after the break. So we'll put you on hold again, okay?
Sure. Thank you so much.
Okay, all right. We'll be right back. Welcome back. Let's go back to our caller. Caller, are you still there?
Yes, sir. Hi.
Okay, hi. So you were going to ask about your daughter. How old is she?
She's about 21.
21. Okay. And so you said she was diagnosed with bipolar and borderline personality disorder?
Yes, borderline
Okay.
personality and bipolar type 1.
Type 1. Okay. Which is the more severe type. Okay.
Yes, and I think it was because of my family history, because she has got the bad gene, and unfortunately, I was not a wise mom, and I was, because of my deep depression before that, I was not treating her very good. Sometimes I just want to explain that time. Then I knew that she has some problem. She was very aggressive. She left the college and she had panic attacks. So I knew that she has a big problem, and she accepted to see a psychiatrist and after that psychologist, and she's very, very better now, very, very better now. But after 1 year, she stopped to see the psychologist. Actually, the psychologist is a Persian one, and he went to Iran, and after some session in the apps, she stopped that, and I'm not sure that she's taking her medication yet or not, because she doesn't talk to me at all. She hates me, and I'm not sure what should I do. I just try to be very, very, nice to her. If she tells me everything, I just try to be deaf, just your dad's there every time. But nothing works that I can have a relation with her to, make her courage to continue her treatment. So I'm not sure if I can do something more that she can trust me, because I'm sure that my behavior, caused that she make a decision. She decided to not have a relation with me.
Okay. So, I mean, look, if we're any kind of relationship, it goes two ways. So the other person has to have the relationship. We can't force them, obviously. We can only control what's on our side. If she has bipolar disorder, bipolar 1, and borderline personality disorder, especially with the borderline personality disorder, unfortunately, one of the things they experience is their relationships are unstable, and it is hard to maintain a relationship for them and hard for someone to maintain a relationship with them. So it's sad that that's the reality of the situation, but at some level accepting that it's going to be challenging, and even as sad as it might be, accepting that you might not have a relationship with her because it's not completely in your control. You can always just be there for her, support her. As far as encouraging her to go to treatment, so going to treatment is a very personal decision, first of all. But secondly, when we look at advice or taking someone's advice, it's not just about if the advice is good or bad. Really, what's even more important is the relationship you have with that person giving you the advice is going to impact if you want to hear what they say, or it's going to influence what you do. So if you tell me you and her don't have a good relationship or any relationship, or she hates you, then you have to understand that, what you tell her, even it could backfire, or she might not want to do what you tell her to do more than it pushes her towards something. So your ability to influence her is limited by how close you are with the person in most cases, or at least how much they trust you or are connected to you. If you don't have that, don't put that pressure on yourself. I have to get her into treatment. I'm going to make her go, because if anything, it might push her away and push her away from you if you put too much pressure on her to have a relationship. Now, you mentioned things you did when she was younger that were not good. Maybe you already have done that, but of course we can always apologize for what's happened if they're angry at us. But from what you're telling me, just very briefly, of those two diagnoses together, it's hard to be in a relationship with someone who's going through that. And we've talked about accepting things a few times during this call about your own life too, but about your relationship with her. It might be something to accept, that it's going to be hard to be close with her, as sad as that might be.
Okay, yes, it's not good. So I just try to be supportive and be there for her, and, wait very gently that maybe she will ask for help in future.
Maybe she'll ask for help. Maybe she'll ask to get closer to you. I mean, we have to always let them know the door is open, but we can't force them to walk through that door, to come back. And even when you say support her, just be aware to not push too hard, because sometimes, when we think about support means what the person wants, not how we want to help them. So also keep that in mind, that, if you push her, it might push her away from you or push her down.
Right. Yes.
Yeah.
Thank you so much. I appreciate it.
Nice talking to you, but wish you all the best. Take care.
Thank you so much for your time, and please give my best regards to your dad. I didn't have a chance to talk to him. Thank you.
Okay, I will. Thank you. You too.
Thank you. Bye.
Bye-bye.
Bye-bye. Bye.
Okay, bye-bye. So, some thoughts following up on the topics that came up. One thing about going to therapy, and I'm happy that she's going, and encouraging her to go, and I'm always encouraging people to go to therapy. I don't like to say that anything is good for everyone or that everyone should go, but I do think it is a good idea for everyone to go, even for a while, to therapy, and actually for a while, not just once or twice, to get something out of that experience. And the reason being that if we really look at the aim of therapy, of course, it's to help with psychological issues or emotional issues and problems. But even at a more basic level, what you're going to get from therapy is better self awareness, understanding yourself better. And so this distinction is important because sometimes people think that therapy is for people who have quote unquote problems, which we all have to a certain degree. We all are going to have some issues, even if it's not a diagnosable mental illness. We all have issues that would be better if we improved on them. And so if we change that mindset that it's not about fixing problems, but it's about self-awareness, well, that's something that everyone could benefit from. And so people, it came up with her in some ways, but it may not have been the actual issue. But sometimes we don't want to ask for help, or we feel weak if we ask for help, or especially when it comes to therapy, we feel like it means we're crazy, or it's something bad to go to therapy, something we should be ashamed of. Thankfully, there's lots of movements that are making it more normal and normalizing going to see a therapist, removing or at least reducing the stigma attached with mental illness and seeking out mental health services. Those things are good, but I know it's still there. It still holds people back from getting help or from going to therapy. But if we think of it as a process of self-awareness, that can be very different. And then related to that about not asking for help, well, some people think I can do it myself, right? I can read books, I can meditate, I can journal. And those things are all very good and very helpful, and I think you should do those things, but they don't replace having a therapist, an outside party, to observe and make connections and help you understand yourself better. You can see yourself in certain ways that no one else can, but unfortunately, you're also limited in some of the ways you can see yourself because it's you. You have biases, we have blind spots, and things that we're not going to be able to see because the same lens you're making your judgments through is colored by certain things that you can't tell are colored because that's the only way you can see the world. But a third person, or an outside person in this case, can look at things in a way that might give you some insights that you'll never be able to come to on your own. Also, a lot of the issues that we have are formed through relationships, either from abuse or even smaller scale things that we've went through. Usually it's through a relationship we've been hurt, and that's another reason why through the relationship of therapy, they can be healed, or at least healing can occur. This is another reason why we can't heal all of the wounds on our own. We need someone else to do that, to help us with that process. So in the process of therapy, you share things that you're thinking, feeling, things you went through, and the therapist will help you become more aware of yourself, your patterns. Why do your relationships go the way they go? How do you even feel about yourself, your relationship with yourself, your relationship with others, things like trust? All these types of things can be explored, and you get a better understanding of them through therapy. And of course, with the understanding, you could then make different choices in your life, do different things, be aware of your biases, be aware of, I tend to be attracted to these kinds of people, but it's actually an unhealthy thing. So if I meet someone and I feel an attraction, I want to make sure they're not in this way because I know my pattern. Now I'm aware of it. So that knowledge and understanding and awareness of yourself can make huge impacts on what you choose to do. But what you get in therapy oftentimes is more of that awareness and understanding. And then, of course, you're going to choose what to do outside of that therapy room, or now it's, let's say, on the Zoom call or on the video call. Because of COVID, therapy sessions tend to be virtual now. But you have to then make the decisions in your own life. And that's another, at times, myth or misconception about therapy. As I mentioned with her, people call a show like mine or my father's or others like this, and they get advice at times, and they think, well, if you go to therapy, within a few minutes, the therapist should be telling you all sorts of things to do and don't do in your life and make decisions for you. But really, that's not what therapy is about, and that wouldn't be helpful for you in the long run. because you have to make the decisions in your life yourself, and to be able to trust yourself and then live with the consequences and learn from the consequences to then keep going forward. But if someone else makes those decisions for you, in the short term, maybe it has some benefit, let's say, at times, but in the long term, it's not going to be good for you. You need to be able to do those things yourself. So it's also an expectation to have or to not have, let's say, as far as what you might see on the radio compared to what you're going to experience with a therapist, where it is more about you talking, them listening and exploring what's going on. They'll ask questions to guide you in that exploration, but they're not going to be telling you explicit things to do and don't do all the time in making big decisions for your life. So something to be aware of. And also related to this process, you might call a show like mine or my father's, and after 15 or 30 minutes, you get that's the whole thing as far as what you experience with us. But that's not what therapy is like and what to expect. It is much more of a longer term process that takes time and should take time, because if you're trying to know yourself better, understand yourself, that is going to take time. And so if we make that our goal, self-understanding, self-awareness, self-knowledge, that takes longer than something that can happen. And to build that relationship with the therapist and then to learn more about yourself, it will take some time. So be ready for that. Somebody's call and say, how many sessions do I need? And of course, sometimes a specific issue can be dealt with in a certain number of sessions if that's all you want to do. And that's not wrong or bad necessarily. But really what I'm talking about, where I think everyone should go to therapy for a period of time, I'm thinking more like 6 months to a year, even longer if you'd like, to really spend time to get to know someone. And that's weekly if possible, for that long, to really explore who you are, understand yourself better, who you are, what you have in your life, what you want, what you don't like in your life, different aspects of yourself and your history that will help guide you, so that it's not to stay in the past. When you talk about your past, it's actually to heal your past, and also to make sure your past isn't dictating your present and your future, because you're unconsciously playing out things that you're not aware of. So without that awareness, you actually tend to live your life in certain ways that are more directed by your past, than if you actually face and acknowledge what's going on, understand yourself better, and then you can choose to make different decisions going forward. So I'm a big advocate of going to therapy, have done years of therapy myself, and I'm very happy that I have, because I think it's been very meaningful in understanding myself better. And there's still more to understand, because it is a journey, but hope at least everyone will do it for some period of time. We all have issues, but even more succinctly, I could say it's because it's about self-awareness and self-understanding, and we all could benefit from that. Let's go into our last commercial break. We'll be right back. Welcome back. In the last segment, I wanted to switch gears a bit and talk about online comments. It's something that, if you want to see sometimes the darkest parts of humanity, or really something depressing, you can go look at the comments to almost any video, any post, that, especially if it's popular and has a lot of comments, you'll see some very negative, ugly things on there. And so, this has been studied a lot and talked about a lot, and especially with how heated the political climate is right now, I also wanted to talk about it. People post something, and of course there's lots of people in full agreement. It's very polarized, so they're very much on board, and then there's other people that are just so against it and will tell you you're evil and stupid and bad and all sorts of things to believe that, or whoever it is saying that, telling it to them. But even in non-political things, you'll just see this dark side. And so it can make us think some things, well, is that our human nature? And this reminds me of the book Humankind that I discussed recently, that was actually saying that human nature is more positive than we sometimes think, that it's negative things. And I think it's both. We have the possibilities of being good, bad, kind, mean, aggressive, nurturing. We all have those possibilities and aspects. So I don't think it's that humans are either all good or all bad. We have the possibility and potential for both. And different circumstances can definitely bring that out, or make that more likely to bring out, but also how we live our life, what we choose to do and not do can also affect that as well. What we're more likely to do as a response is going to be affected by the choices we make, the attitude we have, the perspective we have, the habits that we create. All those things will have an effect on what we then feel and do in later situations. If we turn towards anger with becoming violent, that could start to become a reaction that feels normal or okay. But we can also respond other ways and make those habits as well. So one of the things that we know about people commenting online that makes it easier for them to be so harsh or cruel is that the anonymity we get and that distance that we have of not being seen. First of all, a lot of times your picture is not there, of course, but it can be. But even on top of that, you could have a username, so it's not your name. So you feel very anonymous. And so you can't be in that way seen making this bad action, because we know this has a big impact on us, that when we're not seen, we know no one can see us, we feel concealed in some way, we are more comfortable turning to doing bad things, because one of the reasons, or one of the things that does keep us in check in some ways, is that the evaluations of others. We're very mindful and aware of how people are going to see us. Even sometimes when they have something that looks like eyes or is eyes in front of a sign, let's say that says take one candy, people are less likely to take more. They feel like someone is watching them, even if it's something that's not alive or not active. Just being watched can affect us. And this is part of being human. We do get affected by others and being seen. We do want to make as much as we can our moral compass be something that's within ourselves, that we do what feels right and wrong because we feel it's right and wrong and we think it's right or wrong, but we are impacted by others and how they might judge us, or if they can or can't judge us. If we can't be seen, we can't be judged. So that's one thing we know. Actually, I'll share another study I thought was so interesting is, there's a lot of times these ingenious studies that can help express some aspects of human behavior. But from what I recall of the studies, they would have a car at a stoplight and they would wait to go when the light turned green. But then what they would do is they measured it with cars that were convertibles, either being in front of a convertible. So I don't know exactly how they made this happen. They probably had to drive around and keep trying to make it happen. But they would be in front of a convertible, and they saw that when the top was down, meaning the person was more exposed, right? If your top of the car is down of the convertible, it would take them longer to honk at the person to say go. So it seems like this feeling of honking, which maybe is a little bit aggressive or some people might not like, if you feel like you can be more easily seen, you might wait longer to do it. I thought that was quite interesting, but just another example of how we're mindful of how we're being seen or not seen, and that can affect what we do. But so online people can be very anonymous. They can call you the nastiest, the worst thing, and you might not even see or know who they are. And so say, oh, you're such a coward. You would never say that to my face because you're such a coward. You're doing it behind your keyboard with the anonymity of being unknown by what you're saying. And it is cowardly and it's not good. I'm not saying it's something positive at all. What I also want to look at is the other aspect of it. So, of course, there's the viciousness of what the person is doing and the being anonymous and feeling distant and safe in that way. You're in your own bedroom, no one could touch you really, can make us more likely to act in that way. But the other aspect of this that I also think is important to keep in mind is we're distant from the victim of who we are hurting. So I think a lot of the things that people say, if they were sitting face to face with the person, it's not just about I want to say these things so bad because it feels good. It's that we wouldn't say it because we would feel bad for the other person. We'd have actually compassion if we were in contact with the victim in some way of what we were going to say. So the distance is not just about protection, it's also about preventing or making it harder for us to have that empathy for that other human being that might feel that pain or feel what's going on. And so it makes it easier for us to tear them down, maybe discharge some anger, maybe feel better about ourselves in the moment by putting someone else down, and maybe feel like we're elevating ourselves, feeling like you're dominating someone, all these different ways that it might feel good in the moment for that person. Oftentimes it's because we're not aware of the person we are hurting. And so it's a reminder of that anyone we're talking to is a human being, which obviously sounds obvious, but we often do forget that, especially online in these types of forums, and even more so when we're talking about public figures, be they politicians or celebrities. Even I've noticed it in myself. I try to really be mindful of not gossiping or backbiting about other people, saying negative things. Of course, everyone does it sometimes. I can't say I never have done it. But I do try to be aware of that. But I can notice that I have a different standard when it comes to talking about celebrities or politicians, where it doesn't feel the same as I would talking about someone I know or an acquaintance or a friend of a friend. The standard does feel very different. So I think there is this sense to think of them as somehow not as human, or somehow it's okay to use ugly language or talk bad or gossip about someone who is somehow public or seen in some way. So there's a dehumanizing. Usually we think of lowering someone and making them less than human. And sometimes that's the case with politicians and things, but sometimes it's also because we've elevated them to some type of status where they're no longer human. And so it could just be a reminder that, everyone we're talking about, obviously they're a human being. And would I say that about someone, first of all, if they were in my face, and if I saw them as just like everyone else? And usually the answer is going to be no. I don't think the really nasty, vicious comments you see online, I think if someone were to say them to someone's face, very, very rarely would they actually do so. And like I said, it's not just because they're afraid that they might get hurt or to be protected, but also because if you're looking into someone's eyes or feeling that connection with them by being close to them, you wouldn't say those nasty things. You wouldn't say that to someone. The victim becomes much more real to you as well. And so we have to be mindful of how we operate, or what we do when we're online, how we act, and things that can become, unfortunately, normal. I think, someone's typing these things. Lots of people are. Sometimes we think we could talk in ways like it's these, only some people are doing it, but lots of people are saying these really horrible, nasty things about other people. And so we have to take our own responsibility and recognize, how am I different with how I am online? And how might it be because of being protected and being anonymous? And how much is it because I'm not thinking of the other person as a human being who's thinking something, feeling something, going through something? And so, people can post almost anything, and then people will just come on and be so judgmental towards whoever that is and what they're going through. And I think that's a shame. And about the judgmental piece, something I shared in talking about cults and people who enter these types of organizations, it's very easy to look from the outside and think, that could never happen to me. Or look back in history and think, I would never do this. Or when we talk about experiments in psychology and they say 70% of people did this, and people think, oh, I would never do that. Well, you should at least be open to the possibility that if 70% of people did it, it's actually more likely that you would do the thing you thought you would never do. And rather than just judging those people as being different from you and recognizing that common humanity of being a human being, think about what was it that got them to do that, and how might I do that same thing to then make sure I don't do that same thing if I am in that type of a situation, because I am human too. I also am human. And so if we can remember that, I think a lot of these things that we say to one another might change. And when we look at even the political issue, very often there's a huge amount of dehumanization that's happening now. Even you see in the ways that people talk about each other of being, animals and being monsters and being evil. That's all parts of dehumanizing. You're not talking to another human being who has ideas that might be different from yours or beliefs that are different from yours. You're talking to a monster. And so, of course, you should degrade them. You should talk down to them, or even you have to protect the world from them, which really is usually not the case. So just something I wanted to share with everyone. We're getting closer to the election. Of course, people can vote. I already have sent in my vote. I hope you do too. But things I think are going to get more and more heated, as they already are. But I'm actually concerned of how heated they might get when the election comes around and how people are going to respond. So just a reminder that we're all human beings who are trying to vote for what we think is right. And hopefully we can recognize that common humanity more than we emphasize or focus on the differences. Before I go, another reminder that next Monday, or this coming Monday, which is October 26th, from 6 to 7 p.m. Pacific time, I'll be on a panel hosted by the Iranian student group at UCLA, a panel on mental health with psychiatrist Dr. Nasreen Bashiri. It's on the flyers on my social media, so go check it out. It's open to the public and on Zoom, so no matter where you are, if the timing works, you can join us, and hope to see you on there. All right, that brings us to the end of today's show. As always, a big thank you to Ghazala in the studio, who allows me to do the show from a distance. You've been listening to In Session with Dr. Farid Holakouee. Have a wonderful day.